Okay. Yeah, that's a good question. So let's imagine what happens. What can we guide you? What's the choice? What kind of things can you do? God forbid you have some kind of problem after the MGB. Well, first of all, remember that all phone calls, clinic visits with me, emails are all free after the surgery. So we encourage people to contact me first about everything. Any kind of problem at all, call me. You know, first of all, what's nice is of the 6,000 people that are out there, most of my patients are doing well, so I don't get many phone calls. I'm really blessed, and I think that's a piece of information that's useful to you because I think that MGB in general is fairly low maintenance. You know, now it's not zero maintenance. So we talked yesterday about eating your yogurt and this and that. There are some real serious issues, but in general, it's low maintenance. A way I like to say it is always think that the MGB is the cause of your problems first. Anything at all that happens to you, blame the MGB first and call me. So you're more than welcome to call me anytime, day or night. Again, I won't get every phone call. That's just not possible. But we can get in touch. If it's an emergency, obviously, if you've listened to any doctor's telephone message, to our hospital's telephone message, the first thing they say is, and let me say this for the video for the attorneys, this is an emergency, please hang up and dial 911, right? And that's right. That's still right, even though you have an MGB. And while the ambulance is carrying you to the hospital, you could dial me as a second number. I probably shouldn't be your number ahead of 911. But don't hesitate to call. There's no charge for phone calls. There's no charge for clinic visits. There's no charge for emailing us. We ask you to follow up with us, and we can be very helpful. I have found that a lot of times patients get into problems after the surgery that maybe could have avoided if they had contacted me first. So don't hesitate to make a phone call. Obviously a phone call and an email is much more limited in what I can do for a patient as far as just chatting about things as opposed to coming here to clinic. Now some people from Maine and Canada and Pakistan are not going to easily be able to come to clinic. So we have those other modes, but I don't want to downplay the value of actually coming to clinic to talk out a complex problem. But if anything at all comes up, call us. That's the first step. If you get me on the first ring, that's good. If it's an emergency, you'll go to the ER first as the first thing, and then you can call or email us. Let's imagine it's not an emergency, but it's an issue that bothers you, and you go to your medical doctor first. You may find that there are things that I know that I can help you explain to the doctor and may smooth that management. Again, call. Call before, call while you're there, call after. Any of those things are options. If you get one of those smartphones, you can email, you can text while you're sitting in the waiting room. You know, this doctor doesn't know about the MGB, he doesn't want to do this or something. And again, the problems that we see are kind of listed for you. And I'll just mention the top problems. And there are videos about each of these. I won't take this morning to go through the answer for each of those, but we have the answer for the most common problems. We know what the most common problems are. We know how to prevent them and how to treat them if they occur. So don't hesitate to use us as a resource. Again, to say the same thing over again, to repeat the same thing, to say it over again so you can hear me. I'm trying to repeat this. Call me, right? We have seen patients get into trouble where they don't call. Okay? What's the number 1 and 2 complications after the MGB? Number 1 is an ulcer, gastritis, upset stomach, burning, irritation that occurs when you connect the small bowel to the stomach. That's an abnormal connection. It's not the way God intended, and it gets a little red and burny in up to 5% of patients per year. That number is interesting because it's about exactly the same as if you took a baby aspirin every day. So the data shows that if your doctor were to say, you've got heart disease, I want you to take a baby aspirin every day, which millions of people are on a daily baby aspirin. If you study them, numerous reports show about 5% of people will have gastritis, ulcer, frank GI bleeding, or a perforated ulcer from that baby aspirin every year. Same number for us. We are like a permanent baby aspirin forever. It's a bad, serious, negative risk that goes along with all the benefits of our surgery. And We know about it. We can tell you about it. And we can protect you from it if you will listen. So, for example, don't smoke cigarettes and don't drink alcohol, because those things also wipe away the mucus lining of your stomach and allow the acid of your stomach to burn it, to ulcerate it, to damage it, and potentially to bleed or perforate. So don't do those things. We also know protective things. Eat yogurt. Okay? Take some Tums. Take your Prilosec for the first year or so while we let things heal and protect that lining as it becomes healed from the surgery. So number one complication, a lot like taking a baby aspirin, beware, don't ignore my warning. You could get an ulcer, gastritis from the surgery. And not only that, every single morning for the rest of your life, I recommend you test yourself to see if you've got an ulcer. Drink a glass of tart, fresh orange juice. Okay? If you put acidy orange juice on an open cut, I think you can imagine that might burn or hurt a little bit. If you drink orange juice and you go, ow, or if you have the usual signs or symptoms of burning pain, indigestion, things like that, first thing you should do is call. Yeah, let's call and talk. Come to clinic. Email me. Do something like that, because maybe you're getting the number one complication that we fear, and that's this gastritis or an ulcer. And we have a whole bunch of details. I'm going to skim over it now, but that's complication number one. We do see it, just like taking an aspirin. It's part of the downside of the surgery. Surgery is not all positive. There are risks to go with the benefits, but there's also ways to prevent or treat it if necessary, and we can help in concert with your doctor or back here if you come back to clinic. Number two, I'm sorry, go ahead.
Well, my heart doctor wants me to take that 85 milligram dose of aspirin every day, and I'm afraid to now after I have to.
Well, let's talk about that. That's a really good question, and we'll come to that in 1 minute. So your question is, what about the danger of Dr. Rutledge's MGB plus the danger of the baby aspirin? So what's the right answer? And let me come back to that in a second. The other number one complication, we have two number ones, or anyways, is something that our guys don't have to worry about. It's a problem only in our women, almost always only in women who are still having their menstrual cycle, and that's iron deficiency anemia. Okay, and again, lots of new information we found many of the local doctors don't know about yet, and we can really help with that, but you got to call. Okay? The reason we get it is because a woman is losing iron in her monthly cycle, and it's hard to digest iron in general, and it's particularly hard after the bypass because the upper part of the gut is where a lot of iron absorption occurs. So it can happen. It turns out it occurs again in almost 5 to 7, maybe sometimes up to 10% of our female population, but it occurs in about 5% or so of people who don't have the surgery, who are females who are still having menstrual cycles. So it's very important, and the hot new research finding is a new drug, a tablet, a medicine you can get over the counter called Proferin, and we have videos about that, and we could talk about that more in detail on maybe one of the other videos. So those are the two big. There's other things. You can get gallbladder problems. We talked a little bit about that yesterday, and we take the Actigol. You can get long-term problems of osteoporosis or kidney stones and things like that. And again, we have tips and pointers and advice to prevent against that. So take advantage of contacting me, using the videos, discussing those things prior to and after and during your doctor visits. So we want to provide you with support, and most people judge us when they talk back to us and answer our surveys that we provide much more support than a lot of their local physicians, even though they might be next door. Again, back to your question, I'm going to restate it again. What do we do in the event of a complication if we're in Phoenix or Maine or California or Pakistan or Canada? Well, number one, call. Call ahead. Call before you see your doctor. Call while you're seeing your doctor. Have your doctor call me. Email me, call after. Isn't that like a